Hello, everybody. My name is Jackie Molaski, and I'm the Family Engagement Specialist, as Geraldine explained. So I am going to be giving you an overview of the Phelan-McDermid Syndrome Data Network tonight, and kind of explain to you what we're doing, how we're doing it, and how we can get you all involved. So this is me. I am pictured here with my dog. I just wanted to clarify who is me and who is the dog, so that's how you have those arrows. Harper is our mascot, and she doesn't look like this anymore. She's a lot bigger, but she has helped me a lot with a lot of the PMS data network activities that we've done, and she has helped me really be responsible for supporting all of our families, whether it be with the registry, CareSync, or ShareFile, which we'll get into a little bit more tonight. So just to kind of give you a sort of graphic of the data network, the idea is really to create a partnership where we can increase the size of the Phelan-McDermid syndrome community and the type of information that's collected. So this project is a partnership between the Foundation and the Center for Biomedical Informatics at Harvard Medical School. So the idea is not just to have what's in the international registry, but also utilize any other medication, images, genetic reports, records, anything that is related to your child and their health. We want to make sure that we're including for researchers to have access to. So how can you get involved? The big thing is to sign up for the registry. It's really easy to do. I am a good resource and can help you with that, but we also have quite a few staff that can help you as well. Rebecca Davis is our Registry Coordinator and is really skilled at walking people through the registry and learning what's important for you and how to participate. If you're already registered with the registry, make sure that you update your consent preferences. It's just 8 yes or no questions and can take maximum of 10 minutes. It's very easy to do, and we have a couple of new data sharing options now that we are in this grant with Harvard Medical School. So it's very clear in the question about what the Phelan-McDermid Syndrome Data Network is and how you can make sure that you're a part of that. We are all completely available to answer any of your questions, so do not hesitate to reach out. When you sign into the registry, it will be very clear if you've not updated your consent preferences. You'll be alerted to do so. If you log in and you can go through the registry as normal, then you've already taken care of that. For a lot of people, this is still a little bit confusing, and if you're not sure if you've registered, please feel free to email me. I can check it out very, very quickly. So moving into the data network to give you a little description of why we're collecting medical records. So we talked a little bit about what is part of that data network. So the medical records, medications, things that are already in the registry. Every single record and every page of every record is part of this huge data network. Harvard has a software called Transmart, which scans through all of the documents that are provided to us for the data network. And it pulls out little pieces of text from the information within the whole record. All of the identifying information is removed, so that's going to be names, date of birth, that's not going to be available, but each piece of the data that is medically related is combined with registry data in one place that is very secure and confidential that researchers can utilize. So how can you help? By contributing electronic medical records to the data network. So there are a couple ways that we can talk about doing this and what that really means for you. If you already have electronic versions of medical records, if you know that you've logged onto a patient portal, if you've seen an electronic version, then you're a great candidate for ShareFile. If you don't have any electronic versions of medical records, you've never seen one, you've never logged on, and you don't even know how to start, that's okay. CareSync is a great option for you. Don't worry, all of these options are going to be offered at no cost, and you can absolutely participate in the data network in the way that's most appropriate for you and your situation. So let's talk a little bit about ShareFile. ShareFile is a HIPAA-compliant cloud storage space Very similar to how Google Docs is used or Dropbox, if you're familiar with any of that. I think Amazon now has a cloud storage space. Our account is very specific for healthcare usage, so it really is completely secure and safe. Every family gets their own folder that's only accessible to them, to Rebecca Davis, who's our registry coordinator, and to myself. So nobody else has access to this, and no one else will be able to find it. If you try and Google it, nothing's going to come up. So the way it works is you have access to this folder. You simply upload the records that you already have access to. I can copy those files out and put them in Harvard's secure file, which is located in a different space. So you can't look in there, your friends can't look in there. It's absolutely secure to the people that I've assigned access to. So where do you obtain files for ShareFile? There are a couple of different ways to do this, and something that we can absolutely talk about more on a one-to-one basis. So some people use MyChart, which is an Epic medical record system. They look very different depending on where you're from, what hospital system you use, but they're all run by the same organization. So MyChart allows you to pull out pieces of the medical record that you can use to upload to ShareFile. You also have access to a lot of patient portals. So if there are doctors that you know that don't use Epic and have emailed you information, this is another way that you may be able to log on and access electronic information that's available to you as a download. The other way that's becoming more, we're seeing a little bit more with people, is insurance companies. That sometimes insurance companies will make this information available to people who utilize their website. And this is something, again, that we can walk through together. So do not be intimidated. Call me, email me. I will sit down with you and walk you through what this looks like. So the ShareFile space looks a little something like this. This is kind of my personal folder that I've put together. You can assign folders. You can put in the dates that you see doctors. You can put in specialists and organize files as you wish, or you cannot at all. That's totally up to you, and something that's very user-friendly with ShareFile. So what I do is I just create a name for you that's going to be your folder, and it looks very similar to this. When you want to upload files, you click on an upload file button, and you can either drag files directly in here, or you can browse through your computer, similar to attaching an email. Once you do that, you will be able to upload, and that is all you have to do. So I think probably 2 clicks per file, or 1 if you're dragging it all in. CareSync is another option that we allow that we're doing with families. CareSync is a website that is used as a centralized place to manage healthcare information. The basic free CareSync version is uploading medical records yourself, adding medications yourself, adding allergies or any procedures and labs, but this does not have CareSync obtaining medical records on your behalf. However, there is a way that CareSync can help support these activities without you having to get the medical records for you. So CareSync Plus is a version that will retrieve medical records on your behalf. All you need is the last 4 digits of your child's social security number and the name of as many providers as you can think of. Do you need a specific Hipaa authorization form for each doctor? No. Do you need all of your doctor's addresses? No. Do you need all of the doctor's phone numbers? No. This is a huge difference from the way things have worked in the past with a lot of families and anyone really requesting medical records from a doctor. There are hospital systems, there are doctors that require you to fill out various types of Hipaa forms, and this is one way that you don't need to worry about doing that. When you log on to CareSync, it looks a little something like this. This is my fake account that I've created that I can walk you through. It looks very similar to any other social media page. So you have a little profile picture up at the top left, And on the right, you can see who has access to your account. So right now I have no caregivers, but that changes depending on what group you're part of. So many of you, actually all of you, are going to be part of the Phelan-McDermid syndrome group. You can see appointment dates, care plans, a timeline of your medical history. And the other big thing is adding providers. This is how you make sure that all of your doctors are listed on the left, and how to actually obtain those records. So here I have added 2 of my doctors. And to request the records, you hit that green button in the middle that says Request Records. And I will note that all of the address and phone number information was already in CareSync. I did not add that in. You'll get an option to let CareSync know when you want, how far back you want to go. So Hipaa only requires the doctors keep medical records for 7 years, but it's possible, depending on the doctor, that you could get even more. So you simply select the amount of time that you want to go back to, and you click Next. Once you receive the medical records, up on the top right where it says Documents, that's where everything is going to show up for you. So everything is going to be electronic. If the doctor indicates they do not want to send electronic versions, they will mail paper versions to CareSync, and CareSync is responsible for digitizing those. So those will always be available for you. This is what it looks like when you go into that document section. So things will be separated by medical documents, lab documents, insurance, etc. And below that is going to be all of the Hipaa forms that you signed. So you'll always have access to that and see what it is that you signed, who it was sent to, and what it is that you're requesting. So how are we going to get you all involved with the data network? The first thing is to make sure that you log into the registry and update your consent preferences. From there, you got to ask yourself, do you have access to electronic medical records? If the answer is yes, then email me and we're going to set you up with a ShareFile account. If the answer is no, that's okay. Email me and we'll set you up with a CareSync account. If you just have no idea if you have access, if you think that a doctor may be using it but you've never seen it, that's okay too. You can email me. We'll talk about it. We'll see what hospitals or doctors you all have seen and figure out what the best approach is. So thank you all so much for your time today. I want to make sure that you have the opportunity to ask questions if you have any. Please contact me for more information and to get involved. My contact information, email, phone number, and Facebook page is all up, should be up on the screen. And I'm happy to talk to you anytime. So let me know what I can do to help you. So thank you so much.
Jackie, that was great. Thank you for all of that information. One thing, I have heard a few questions about CareSync, and I guess one of the questions people have asked is, how long do you have, so families can access those records themselves, correct? The records that are collected through CareSync.
Through CareSync, they will always be available in that document section. Even 10 years from now, those records will be available. Where the time lapses is in how long you have to request the records. So from the day that I set you up with CareSync, you have 60 days to request records. After 60 days, you won't be able to request any more records, but what's already there will always be available.
Okay, great.
Does that answer the question?
Perfectly. And how long will this opportunity be available for families who might feel like CareSync is the right option for them?
Right now, we have a number of accounts that are available to use. I think this is an ongoing process, and we're going to have to see how long we have. I'm not really sure the answer to that. Okay. I think the sooner the better. Okay. But if I know that with school starting and the end of summer happening, people may need a little bit of time to get things going, but it's a very quick process. So hopefully that helps.
Okay, terrific. So I want to just encourage everybody, if you have a question, to use the chat feature in the control panel. We have one question that's just come in through the control panel. How can you get records that are older than 7 years old?
That's a great question. Let's see, did my screen just disappear? Okay. Sorry, I'm just going back to the end. So getting those records can be a little bit challenging because HIPAA doesn't require that the doctor hold on to those records. So unfortunately, I think it's going to have to be a case-by-case situation with the physician. If they don't have access to that anymore, that's going to be very challenging to get. Some of them just have places where they hold historical records. And that just may be that it's a little more time consuming for them to collect it, but still possible. So it kind of depends on the doctor and maybe something that, we need to see what the policy is for those physicians.
Okay. Can you participate in CareSync if you're not participating in the registry?
Yes, so we are leaving this for registry participants only. There are a lot of individuals that are part of the registry but haven't necessarily filled out every single questionnaire, and that's not a limitation. We ask that you just register and answer the consent questions. I think there are 8 of them.
Okay. We're in Ontario in Canada.
Mm-hmm.
How can we participate?
Great question. So the PMS data network is available to all families, no matter where you live. The CareSync option is only available to U.S. participants. They only work within the U.S. government and the laws surrounding medical records that way. But there are other ways that we can help you obtain your medical records and upload them to ShareFile. So that would be the path for you.
Okay, that's a great suggestion. Here's a comment.
Okay.
One of the things we've seen on Facebook are a few comments. Hey, I signed up with CareSync a couple of weeks ago. Haven't gotten my records yet.
Mm-hmm.
What's sort of the typical time frame from the time that I list all my providers until my records are available?
So the way that it works is CareSync gives doctors 30 days to respond. So once you fill out the HIPAA form, if there is a fax number listed, it will get faxed that day. The doctor receives it and they have 30 days to respond. If there is no fax number listed, you can certainly go ahead and add the fax number, which will make things go quicker. If not, CareSync will do the work to find what the medical records fax number is, but there is going to be a delay in getting those records because they have to take the time to find the fax number, add the fax number, send the fax over to the doctor, which could take a couple extra days, and then the 30 days ticking clock starts from there.
Okay.
So it is 30 days for the doctor to respond. Then once the records come into CareSync, it's going to take them a little bit of time to scan them and upload them. I think from the beginning, they seemed a little bit overwhelmed by all of our participation. So the beginning, I think, was a little bit slow because they were hiring new staff to help us out with that. We now have a number of CareSync staff dedicated specifically to our families. So as time goes on, that's going to be moving quicker. I know there were a lot of uploads this week. We've received, I think the latest from this morning was over 400 records from maybe 40 doctors or so. But the average time, the maximum time is about 30 days, and with the amount that's coming through from all of our families, I would expect it to be probably about that long.
Okay, so that was one of the questions, was how long really does it take for CareSync to reach out to the providers? And so it sounds like there's a little bit, if there is some work that's involved, and it could take potentially a couple of weeks for them to begin to make that first contact with the providers.
Right, and so if you're willing to add in the fax number and take a few minutes to find that, it'll go a lot quicker. If not, CareSync will absolutely do it. It'll just delay it by a couple of days.
Okay, that's a great tip. After the first 60 days with CareSync, will it be our responsibility to load our own medical records? That's a great question. What happens after those first?
That is a great question. That is a great question. So after the 60 days, you will not be able to request any more records without paying. So it's up to you if you want to pay for that service, but it is right now a one-time fee. So paying for that and requesting records at day 61 is probably not the best use of money. That's something that you can think about down the road. If you don't want to do that, you can certainly use CareSync as a way to centralize all records if you can collect them another way. So if you want to request them from your doctor and you don't want to pay for CareSync and you receive the files another way, you can certainly upload them into CareSync yourself. In terms of it being your responsibility, it's up to you if you find that to be a valuable way to collect and store the medical records. They organize it very nicely and by doctor, so that's something that you can continue to do. So those are some of the options, and we can always talk about that one-on-one if somebody has a specific situation.
Okay. Can you tell us about the iPad giveaway?
Yay, I'm happy to. So part of the data network, as part of the data network and motivating everyone to get involved, we are raffling off 4 iPads over the course of the summer, 2 of which were just awarded to 2 families last week or the week before. So there are 2 more that we're going to be raffling off at the beginning of September. And everyone gets 1 entry for being part of the registry and updating your consent preferences. You also get 1 entry for each medical record that is part of the data network. So if you upload a record to ShareFile, that's an entry. If you get records through CareSync, that's an entry. So you get entries up to 11. So once you hit that, we're not going to give you infinite entries, but that will kind of be the maximum. So we'll be doing those drawings in a couple more weeks. So that's how you can get involved, by participating.
Great, but we do encourage people, right, who have more than 11 or 10 files to go ahead
Absolutely.
as much as they can get their hands on. Okay.
Absolutely.
And
one thing I do want to clarify, which I know I got this question, is if you are participating in CareSync and have received files that way, you do not need to upload them to ShareFile. It's kind of it's something that we can do on the back end, so you don't need to download everything from CareSync and move it over to ShareFile. That's something you absolutely do not need to worry about.
Can you just briefly address the uses of this kind of electronic health record data, and really what's the value of it? And when you think about, well, how do we, really use this kind of data to benefit research? Help us understand the context of, everybody trying to upload as much data as possible to create that full picture.
Sure. So having a really rich data set will compile all of the medical records, all of the doctor's appointments, the various specialties, the demographics, really everything that makes up our community and our families, and making this available for researchers to be able to use for access to clinical trials, for them to be able to use in communicating with families is really important. The software that Harvard is using is called TransSmart, and it does something called natural language processing, which is very similar to how you might control F through a document. So it makes things very searchable in a way that hasn't been before. So the way that researchers have been able to collect information has been very limited, because a lot of these medical records are very, very large, and there's not much you can collect out of them without doing manual reading through. So it's a really nice way to build up this database where it's collecting information piece by piece in a huge data set. So I'm happy to share a little bit more information if there's anyone else who wants more. It's complicated but also very interesting.
Yeah, that's a great response. And I think, also we have a lot of questions still about how does deletion size affect the phenotype in Phelan-McDermid syndrome, and potentially we may be able to answer those questions to some extent by collecting these kinds of electronic or data from the electronic health records. And potentially, you mentioned clinical trials, but even just understanding sort of the natural history of Phelan-McDermid syndrome. Oh, well, we tend to see this thing happening at a certain age, and then by the time people are 20 or something, maybe we see this phenotype. So it potentially could help us really get a more clear picture of the effects of Phelan-McDermid syndrome across the lifespan as well. So tell me a little bit about how this project is getting funded.
So this is a grant from PCORI, which is the Patient-Centered Outcomes Research Institute, which this was awarded, I think, maybe a year and a half ago. Geraldine, you may know the timing better. And it is actually a very competitive grant that was awarded to the foundation in Harvard to really support outcomes for patient communities. I think we were one of, I don't know, maybe, I don't know how many applicants, but it is an incredibly competitive grant, and I can't even take credit for writing it. So I know we have a large team that has been really instrumental in using what they know and their expertise to write this grant and get it funded to really support the community. So we really want to thank them all for their hard work.
Right, and a big part of it too has really been the foundation supporting this, making foundation resources available. There's been a lot of accounting and administrative support that's been provided by the foundation. So we are really, again, just a reminder to everybody, these kinds of initiatives are only possible when we have great community support and people out there helping the foundation with fundraising. So
Absolutely. And we got funded for phase 2, so we're very excited to be able to continue this work and help our families.
terrific and very, very exciting. So a couple more questions here, and then we'll need to wrap it up. If we are continuing with a doctor whose records have already been requested and received, and then the patient is seen again at a later time, is there going to be an automatic follow-up with that doctor?
Yes. Good question. So there is, so when you, let me go back. Are my slides still showing?
Yes, they sure are.
Okay. So this is what it looks like when you are about to request a record. So the green button that says request records will turn blue once the records have been requested. As the files are coming in from the doctor, uploaded in, that button will stay blue until all of the records are received. Once they're received, it'll go back to green, meaning that you can re-request records. So if your child, if you get all of your records today and your child has an appointment next week, the new appointment information will not flow in automatically, but you can re-request them just by clicking that button again. So the same process of clicking the button, signing the Hipaa form, and faxing it over will be able to help you get those records. So it doesn't flow automatically, but you don't need to go through all the doctors again. You'll just have, it's kind of a push to get all the records to be sent as you request them. So it would have to happen after each appointment. So a better strategy may be to request all the records as soon as possible and then request them all again at the end of the account period.
Okay, so we are right at the finishing time for our webinar now. Jackie, you have prepared a post-webinar survey. Would you like to tell people about that?
Yes. So we have a post-webinar questionnaire that I would love for you to fill out, so you can tell me if this helped you understand the PMS data network a little bit, and we can get some information on how you might be interested. If you could take a few minutes to fill that out, that would be wonderful. I think Geraldine is going to share it. It should be in the chat box all the way at the bottom. So if you would take a couple of minutes to fill out that survey, it would be much appreciated, so I can help understand what need you still have and what questions I can still answer.
Great. Jackie, thank you so much. I actually, I've been so involved in this project and I learned so much from listening to you tonight. So thank you so much. We have several comments here. Great job. Thank you. We really appreciate your time, Jackie. And again, I just want to end with a final encouragement to all families. Call Jackie, email Jackie if you have any questions, if you want to participate, if you're not sure, you just want to get more information, don't hesitate to reach out to her. We just want to make sure that everybody feels comfortable, if they want to participate, that all of their questions have been answered. So, all right. Well, until